the damage from the fear and the coercion and the enticing individuals to take a shot and tell on your neighbors. This was all that what transpired, and will all be part of the claim.
So people need to be writing their MLAs. They need to be writing to Danielle Smith and saying in no uncertain terms they expect Alberta to settle this lawsuit and figure out how they're going to pay for all of the, all of the horrible things that Deanie Hinshaw and all of the other, vaccine cultists visited upon the citizens of Alberta. Through all of the coercion programs that they implemented, through all of the misinformation that they promulgated, et cetera. The government just needs to get its head around settling this lawsuit sooner rather than later.
Do you remember when the government determined that unprecedented lockdowns, school and business closures, and the general shuttering of society as we once knew it was justified, even if it saved only one life? Well, according to Prime Minister Justin Trudeau, a vaccine was the only way, the ticket even, out of the pandemic and these perpetual lockdowns. By April of 2020, Trudeau shared that fear-mongering modeling was the new normal until a vaccine could be developed.
This will be the new normal until a vaccine is developed. Normality, as it was before, will not come back full on until we get a vaccine for this. And as you say, that could be a very long way off.
Chief Public Health Officer of Canada, Theresa Tam, even stressed how the government was working quickly to ensure Canada was a global leader in vaccine research and development and retention.
One of the world's first pandemic influenza vaccine contracts in the world. And we are striving to be as early as possible in a global leader in vaccine development, and also ensuring that we look ahead to that day when we do have vaccine candidates, that we're in the best position for that. So that's some of the roles that we're doing.
Deputy Prime Minister Chrystia Freeland readily aligned herself with these sentiments as well.
That we need a vaccine to really be through this.
But those vaccines, expedited through an interim order granting them essentially emergency use authorization, are now responsible for almost 500 deaths, nearly 60,000 adverse events across Canada. And the government is on hook in at least one case for $10.5 million in damages in the case of injured Albertan Kerry Sakamoto, whose lawyers have now filed a class action lawsuit against the federal and provincial government of Alberta for those harmed by the COVID-19 vaccines. But unfortunately, discussing these things that contradict the safe and effective narrative goes against certain platforms' community standards. And so if you'd like to see this report in full and the evidence as it's presented, please scroll down to the description box below where you can find a link to be redirected to another platform and watch the full report there. See you on the other uncensored side. As more information and data comes out around the novel COVID-19 mRNA injections, we've since launched a petition and email campaign at nomoreshots.ca. At that website, you can sign our petition, and you can also send an email calling on Federal Minister of Health Mark Holland to revoke market authorization for these products. Find out about it and more at nomoreshots.ca, and consider supporting this kind of journalism if you think it is of importance for the public interest. Thanks for your support.